And so it's exactly what the Health Data Initiative seeks to do, to liberate data from the vaults of HHS and other agencies while rigorously protecting privacy in order to spur innovation and entrepreneurship that improves health and healthcare, helps create jobs, and grows the economy. So the ingredients in the Health Data Initiative are actually threefold. First of all, we're making brand new data available that has not been made available to the public before, while rigorously protecting privacy. Secondly, maybe less sexily, but equally importantly, there's a lot of data that HHS had made available, but in the form of books, PDFs, and static websites, which were not useful to third-party developers. So we're actually taking that data and turning it into data that's actually usable by developers. Liquid, machine-readable, computer-readable data that can be imported by developers into applications and services that they can then utilize and fuel with that data to produce lots of benefits for the American people. And then on top of actually making brand new data available and actually making existing data machine-readable, liquid, and usable by developers, the third thing that we're doing may actually seem like the simplest and most obvious, but in many ways actually turns out to be phenomenally important. We actually found that about 95% plus of American entrepreneurs and innovators that could turn our data into new products and services didn't really even know what the US Department of Health and Human Services even does, let alone the fact that we have all this data, let alone the fact that we're trying actually to make it available to them as fuel for innovation. So we ended up having to do, which I'll talk a bit more about later in this talk, an education campaign to publicize our data to entrepreneurs who could then actually turn it into all kinds of services that could actually help people.